Brilliant. So what I'll do as well, because I can't always see everybody, I'm going to turn my camera off, and then if anyone has any questions, please just kind of shout out, or if Tanya or Shelley, if you can see anybody's hands raised up, then please do let me know. So again, this is Introduction to Access Social Care. We offer free training on how to use the CARE Act and how to help people and support them around any CARE Act or social care support that they need. Bear with me, I've just realized this has opened up the wrong sheet, and I'm going to reshare so it starts in the right place. Oh, okay. 2 seconds. Sorry, ladies. I closed it earlier on. Right, it's open now. There you go. I'm going to reshare and we're going to restart. Shows that I'm not used to using Zoom all the time. Right, here we are. So we'll start again. I'm going to go to slideshow and play. So again, please do stop me if you've got any questions and just jump out. So the objectives of today are to look at our vision and mission, so that's access social care. Look at the difference quickly between social care and healthcare, because sometimes we don't realize what is the local authority's responsibility and what is the NHS's responsibility. And we found in the past that sometimes those two institutions will play on that and prevent people or delay their access to social care. We're going to talk about quickly how we'll work with you to make a change, some of the issues we've helped people with, and then go into the session on the CARE Act so you know what you're entitled to. So our vision is for social care to be properly funded, readily available, and fairly distributed, enabling people to choose to live the fulfilled and meaningful lives. And what we've seen through our data is that some communities, including the Black community, don't have equal access to this. So this is what we're really passionate about changing. Our mission will be to be a central hub for social care advice, and to align the sector and drive system change. So it's not just about supporting you on your individual cases for yourself or your carers. It will also be to challenge the local authority to improve how they work, so that generally people don't have to go and seek for legal advice, they're getting what they're entitled to. So, social care. So the difference between social care is that it's generally a term for non-medical services, and that's provided by your local authority and independent bodies. And this could include the voluntary sector, which many of you know, to support the needs of individuals such as older adults and people with learning disabilities. The aim is to help people to live their life as fully and as independently as possible. The help includes washing, dressing, assistance with preparing meals, with eating, drinking, help to use the toilet, meals on wheels, transport, and many more. And many of these things are charged by social care. So healthcare is about maintaining or improving your health holistically. So this could be through diagnosis or treatment. It is about the support and medical care given during the time surrounding birth or death or in between. And examples of healthcare, as you know, are medicine, dentistry, pharmacy, etc. Sorry, healthcare is not free, and as you know, we pay for this via our taxes. Some people with long-term or complex health needs qualify for free social care arranged and funded solely by the NHS. And that's when it's more of a medical complex need rather than a social need. And we'll go into that a bit later on. Where there is sometimes, which I mentioned before, a dispute between the local authority and the NHS, it's not for you to decide. And we found that many local authorities will try and push that back on you. They are supposed to be cooperating and liaising with the NHS to agree who funds it, so you don't have to do that work. And we often don't see that happening. So before we go into the detail, what is your experience of adult social care? What's some of the best things you've experienced and some of the worst things you've experienced or seen? So I wonder if we could go around to the group. What are some of your experiences of adult social care?
Faye's coming up.
Thanks, Faye.
Social care. Is somebody else saying something?
Go ahead, Elsie. That's fine.
Right. I'm an ex social worker.
Mm-hmm.
Right. So being in the social care 31 and a half years.
Wow.
So I knew about the care package you're talking about.
Mm-hmm.
It's not free, but it means tested.
Yes.
So sometimes people got to pay because of different depends on benefits.
Mm-hmm. Mm-hmm.
So they will check how much you think you have, you know, it's 16,000 or whatever. Then
Mm-hmm.
you will pay for that type of service, hourly rate.
Yeah, yeah.
And so we work with social care and health. So we are the social, and health is to do with the medication in those areas. So
Brilliant.
we work both close together for years.
Brilliant. Yeah. What are some of your best experiences of social care and worst experiences, Elsie, as you've had that kind of great insight?
Well, I
and
had
experience?
one, and in 2001, when I really decided I had enough, when I was 61, I decided I'm giving up, because what happened is, because we work with the hospital, I work for Lucian for 31 and a half. So therefore, going to take in an assessment for 1 meal and wheel that time really put me off. They were having 4 meals and wheel because of the deterioration of the person. They need an extra day. I have to present in a panel of 10 people, with this our manager, district nurses, and all those people. And we had to go to Lucian Hospital. I drove and I parked up and I went, but it knows me already in a nice way. Why do I have to come here with for you to offer 1 meal and we to agreed? You're getting 10 pounds an hour.
Yes.
10 pounds an hour.
Yeah, it's
and I said,
outrageous.
all right, then Elsie, just have the 5 days. And that was it. Things were so changing. Yeah.
Wow. Wow. And can you imagine that's got a lot harder now? And look, I mean, well done for standing up. You know, what we've seen from a lot of social workers is they get pressurized by their managers to make cuts. And they don't always feel that they can. So thank you for sharing that, Elsie.
And I also was one of the home care, or they had home care organizer in the boroughs before they were privatization. I had 20 staffs, and I will never go in, send someone in without I see if it's a 2 double up. If it's 2 double up, I make sure that morning I go in my trousers early when they are going to see how things are and assess. I do assess the person already for that care.
Yeah.
So therefore, I work in sheltered housing. I was a sheltered housing warden, as every those things. So everywhere I go was to do with social care and health.
Wow. So you've got a lot to share and experience. Thank you, Elsie. You know, we've heard of many really good experiences of social care where people are getting the support that they need, but a lot of really bad experiences. And unfortunately, because of the local authority, especially in Croydon, that are going through the debt and issues that they're going through at the moment, it's got worse. So this is why, and I'm really happy that this legal team have decided to give free support to our communities, because we're really struggling to get the right support for people. So thank you for sharing that, Elsie. I'm going to stop again and go back onto the presentation. So just a quick poll. So how much do you think central government's funding of local authorities has been cut since 2010? 30%, 50%, or 60%? So quickly, let's go around. There's no, oh, hold on. Oh, I can't see anyone. The video's come back on. Let's go around 30, 50, or 60%. And remember, this is 2010, so it's probably cut a lot more now in 2023. So maybe a shout out of hands. How much do you think central government funding of local authorities has been cut since 2010?
Jay is saying 50%. That's
50%.
from Jay.
Thank you,
I said
Jay.
the same. I said the
Yeah, you
same.
say the same.
I'm
Really?
gonna say 60.
You're going to say 60?
Feels like
Because
60.
it feels like
Feels like
60 to
it.
80 to me.
It feels like 60. Now, this is one thing I've been saying to our team, because this was done from a research paper around 2015. So although we say 50%, we know that that's definitely increased to 60%. But just to give a little bit more background on that. So again, remember, it's more than 50% now, but 75% of local authorities have said that they are not confident or are only partially confident that they will meet their statutory duties, so that's their legal duties to provide social care in 2022 and 23. That's absolutely crazy. You know, in what other public service would a public body leader boldly state that we're going to act unlawfully? A 2017 survey by Community Care showed that 68% of social workers who took part in a survey felt under pressure, which is what I mentioned earlier, from their senior managers to make cuts to packages of care to balance their books. So not prioritizing people's needs, it's more about staying within budget. So this is some of the issues that we're seeing in Croydon and across the country. Okay, so we often hear from managers and other members and carers and people who need social care that they feel there's not enough. There's not enough things being done, and the funding crisis has made things worse. There's no money, and so they just have to make do. A lot of people are told by social services and social workers, we can't help you with that, we don't have enough money. And that in itself is unlawful. Regardless of how much funds they've got, they have a legal duty to provide that care and support. Obviously, we need to be fair, and obviously they can't, you know, magic money from nowhere, but that's not an excuse to allow people to live in really, you know, disgusting conditions. So the good news is that we have, and that's Access Social Care, a 98% full or partial success rate with our cases. A lot of our work is based on the lawyers, the legal team, and pro bono workers that support people for free. So let's make sure that we can help as many people as possible. And again, we're really passionate about enforcing this in Croydon because we know the crisis has got worse. I won't go into this slide in too much detail because I know we're behind time, but this is just some of the things that we try and focus on, some of our work streams. So to empower, so providing legal education like today, training for workers such as BME Forum staff who do amazing work and have existing relationships with you, to do workshops with communities and events and other organizations. We don't want to just empower people and tell them what they're entitled to and leave them stranded. We want to enforce, so providing early legal help to hold public bodies to account. So again, this is talking about using that chatbot I mentioned earlier, and we're going to do a little video on that later. And you'll be able to go into the BME Forum. They have this on their website, and that will be launched soon. And you'll be able to use this free legal tool that's been created by our legal team to help you challenge the local authority. Sorry, any questions there?
I said that's good. Am I? Oh, sorry, sorry.
No, please, it's fine, Elsie. No worries. Our place-based hub. So that's something I'm leading on. So, you know, Access usually work with big providers that provide social care and support and train their members and their staff. But they realized that that was only supporting a small part of the community and that certain communities were getting left out. So they wanted to provide this free support to Croydon communities, to Southwark and Lambeth, and that's what we're starting to do now. And then we've got a caseworker that we've just got, which is amazing. So instead of just using some of our clinics and our chatbot, we've now got someone that can take on people's cases and help them all the way through, which is an amazing resource. And then again, I mentioned earlier, we collate all of this information from this, and we then go to work with the local authority before we challenge them to try and get them to work more lawfully and change some of their processes and practices. Yeah. I'll move on. So as we know, words have power, and our team are really passionate about supporting communities around this. So again, I'm trying to rush through this so we can get to the nitty-gritty of the Care Act. So these are some typical examples of how we've helped people. So we prevented many cuts to packages of care. And we've seen in Croydon recently that that has happened on an overall extremely large case where we're seeing people just being told instantly, we don't have enough money, so we're cutting your packages of care. And where people aren't aware that that's unlawful or don't have the resources to get the legal support, they're just going without. And there's some really horrific cases that I've seen recently, which is quite sad. We've helped people to secure increased care and support where they've had insufficient packages of care, similar to what Elsie mentioned there earlier, where someone needs a little bit more support and the local authority are pushing back. So we've been able to help people get that. We've prevented local authorities from moving people into older people's homes when they fail to carry out an assessment or appoint proper advocates. And we'll go into that a bit more later on. And assisted with funding disputes, again, like Elsie mentioned, between the local authority and the CCG, which is our NHS. We've secured waking night support where there was insufficient staffing levels, secured statutory advocacy where it was previously denied. So this could be that a person's language, English is a second language, so they're not able to communicate what they need. And instead of some of the social workers or care coordinators providing an advocate, they've just said, well, the person didn't say they needed help, and then they've gone without. And again, that's unlawful. We've addressed failure to carry out adequate social care or mental capacity assessments. So where that hasn't been detailed, and again, from some communities, we're seeing where they haven't taken into consideration your cultural needs, such as the type of food or religious needs that you have. So we've helped to support people to get what they're entitled to around that. And we secured several discharges for people with learning disabilities that have been experiencing inhumane treatment within inpatient units. So again, I won't go into too much detail on that, but that's some of the stuff we've been able to do. Is everyone okay to continue rather than having a break? Just because I know we're a little bit behind time and I want to cover as much as possible. Yeah, okay, brilliant.
Yeah, no problem.
Fine, Janine, that's fine.
Thank you. So again, we're going to go on to the Care Act section, and this is your legal entitlement. So the objectives of the session today will be to help you understand the 4 stages of securing your social care. These 4 stages include assessment, your eligibility, charging, and care and support planning. And they have to be done in that order. We found sometimes the local authority will start with charging rather than an assessment, and that is unlawful. And that's where we've been able to ensure that doesn't happen. So the first stage is assessment. This stage is your first contact. This is your initial point of call with the local authority, and this identifies your needs or the person you're supporting needs. The threshold for the assessment has been set very low by the Care Act, and local authorities must undertake an assessment or a carer's assessment for any adult with an appearance of need for care and support, regardless of their financial situation. And that doesn't always happen. The assessment has a dual purpose. Firstly, it's a gateway to care. You can't access social care without an assessment. And secondly, it's classed as a critical intervention to prevent things from deteriorating. Wherever possible, this intervention is aimed at helping an individual to understand their own needs and how they may be able to meet them, or it can help a person to understand what support is available to them in their community. So according to the Care Act, the assessment should happen within a reasonable time frame. And we say, and that's known by the legal team and a lot of lawyers, that this is roughly within 3 months. We've seen many times where people have requested an assessment and they've waited 6, 12 months. That is unlawful. And that's where we can help with one simple letter. To give an example, when I first got introduced to Access Social Care, I was managing the social prescribers in Croydon, and we started to have many cases where people had written off and requested an assessment, and waited 5, 6, 7 months with no even response or acknowledgement of the request. We got trained, we used a chatbot, we sent one letter off, and no word of a lie, the next day they got a response from the adult social care, and the assessment was booked in a week later. So that's how much, you know, knowing you're right and getting that support can help you. So according to the carer, an assessment, must be person-centered, have a focus on preventing or reducing your needs, take account of fluctuating needs. So if a person has a bad day, they have to look at that as well as a good day. They can't say, well, when we came to see you, you were fine. No, maybe in the winter, you're not going to be fine. And they have to take into account your fluctuating needs. It must be carried out by someone properly qualified to assess the person. So if it's a person with dementia or a specific learning disability, they have to have that experience. If the person is dual sensory impaired, that is, if they're deaf and blind, they will require a specialist assessment. In this case, 2 assessors with the correct experience and expertise can be put in place. The assessment must be accessible, and in that we mean the communication needs must be taken into account. So again, if English is a second language, or if you need to get someone that does sign language in, that has to be done. And sometimes we find that that's not taken into account. The assessment must be carer blind. So they can't say, well, your mom's here helping you or your son's here helping you. No, they must assess you as if no one's there and you're by yourself. And the person should be given a copy of their assessment once it's completed. And many times we find that doesn't happen, which makes it really hard to challenge. Yeah. Any questions on that before I move on? I know I've moved quite fast.
No, that's good.
No? Brilliant. Okay. So the person should be supported to be involved in their assessment. And this may involve having reasonable adjustments, an appropriate person or an advocate for somebody with substantial difficulty, as we mentioned, being involved or being present, a best interest decision for those lacking mental capacity for that specific decision in line with the Mental Capacity Act. We don't have time to go over that now, but if anyone has any questions, we can do another session or I can send you information on that. And that's mainly when we're talking about people with dementia and other conditions as well. We don't have the time in this training, as I said, to cover it, but we do have a link and some information that I can send round about the care assessment and support and involvement.
They have the advocacy, isn't it? You have people to advocate for them as well.
Yes, exactly.
Power
Thank
of
you,
attorney.
Elsie. Yes, completely. Thank you. It's important for you to note that an advocate can't be someone who is providing the person with care or treatment in a professional capacity or on a paid basis. So it has to be independent. So it can't be someone's GP or nurse. The person should be able to choose that person if they're able to underneath within the Mental Capacity Act. So they should be able to say, actually, I want my friend to be with me, or I want this advocate to be with me. The appropriate person needs to be able to support and represent the person's wishes and views and facilitate their involvement. They can't take over for you. They must be objective and able to understand the process themselves and be involved, present and available, and ideally meet with the person before the assessment. We do have a really useful information pack, which helps you to go through some of the points in your assessment that you can go through before the assessment's carried out. So if you do want that, that can be provided to you. And that ensures that you know exactly what you're entitled to, what you should be asking for. So before we move on to stage 2, which is eligibility, let's look at the difference quickly between an assessment and a review, because we've noticed many packages of care have been cut based on a review, and that's not allowed. So the assessment assesses all of the person's needs in order to determine a package of care and support. A full assessment should take place each time a person's needs change. If they get worse, a full assessment should be done, not a review. Do bear in mind, though, that this could potentially reduce or increase the package of care depending on the needs.
Yeah.
A review is there to determine whether or not the package of care is meeting needs. So once you've had your assessment, you've got your care plan, you've got your package of care, a review is there to see if the package you've got is still meeting the needs. Yeah. A review can take place anytime as is needed, but should take place 6 weeks after a package of care has been set in place, and then every 12 months. And we found that Croydon Council don't do that. A review can tweak a package of care, but if needs have changed, it should trigger a full assessment. Yeah, and only then can cuts to your package of care be made. So I'm going to skip quickly just because of time. Any questions on the assessment and the review? No. And again, we can share this video if I know it's a lot of information to give in an hour. And we will be doing another session face to face if you want to come in and find out more on specific questions.
They used to talk about need-led, isn't it? They took out that bit, needs-led.
Yes, they do. They do.
Yeah.
They do, and we're going to go on to that a bit more later, Elsie.
Okay.
No problem, but we have covered the first stage, as we said, the assessment, and now stage 2 is eligibility. So the assessment identifies all of the person's needs, and the local authorities have limited resources, as we know, and they're not required to meet every single one of these presenting needs. They only, by law, need to meet the needs which are classed as eligible. So we're going to look at that now. So this is the framework that the local authority must use. It's called the National Eligibility Criteria, which is a single framework for determining whether any assessed care and support needs meet the threshold for support from the local authority. So these are things that they have to cover. Just for information, it's set out in Section 13 of the Care Act, and it's a 3-step process. Step 1 is that a person's needs must be caused by a physical, mental impairment or illness. So if you have one of these, or you know someone that does, they might be able to get social care. Step 2 states that the physical or mental impairment or illness must prevent the person from achieving 2 or more of the specified outcomes that we're going to go over shortly. Step 3 states that as a consequence of not being able to meet these specified outcomes, there is likely to be a significant impact on your well-being. Yeah, so we're going to go into that quickly. So these are the specified outcomes, and these are the things that I think are most important, that maybe we could send you a copy of this particular sheet. So the specified outcomes are measured as part of this national eligibility criteria and must be tailored to the person's situation and cultural needs, and that doesn't always happen. As you can see, this is really an extensive list of outcomes, and it's a real gift if the assessment's carried out properly. So the first 6 are managing and maintaining nutrition, maintaining personal hygiene, managing toilet needs, being appropriately clothed, being able to make use of your home safely, and maintaining a habitable home environment. Yeah, and these are it's probably safe to say that most of those first 6 are what most care and support packages will meet, although they're not always done effectively, and sometimes we know it could be a battle. But it's 7, 8, and 9, and I'll read them. Developing, maintaining family or personal relationships, accessing and engaging in work, training, education, and volunteering, and making use of necessary facilities or services in your local community, including public transport and recreational facilities or services. Now, these 3, they can cause the most battles, and that is where we're seeing most of the packages of care being cut. You can see that this list covers a wide range of things that the Care Act says, or says rather, are of equal importance. So we find some local authorities are saying, well, we only cover 1 to 6. They're not allowed to do that. That's unlawful. They have to look at them all equally. If the assessment fails to cover all of these outcomes, it's probably open to challenge, and that's where you can either contact BME Forum or ourselves, or use the chatbot, and send a letter off to ask for a proper assessment to be done. It's really important that you're aware of these, and we have resources like I just listed that can help you prepare for an assessment or challenge an assessment if needed. Yeah. So some of the things we will look at is, did the assessor look at whether a person is able to get out and make friends and access leisure facilities that they would like to? Or if it's a mental capacity act, if they're underneath that, it's been decided underneath their best interest that they need to be involved in this particular activity or facility. For young people, that leisure facility may be a bar or nightclub. For older adults, you have the right to get out and access leisure facilities too, and see friends also. And this is often overlooked, and we're seeing a lot of people being isolated and housebound. So I'm going to look at one of these as an example, and we'll focus on managing and maintaining nutrition. But before we move on, any questions? Is the speed okay, or am I going a bit fast?
No, you're okay. Just some things there, just remembering.
Yeah, don't worry, you can get a copy of this. Tanya and Shelley, I'm happy to go over. Are you happy to, and is everyone else happy to go over?
Over.
With me.
As in time, sorry, because it's 10 to 6 now.
Yeah, that's fine with me.
Yeah, I'll
We don't-
continue.
We have enough. Just continue.
Yeah, brilliant.
Well, just me. Yeah.
6 latest, Janine, I think.
Say that again.
6 latest.
6, brilliant.
Yeah.
What we could do, is everybody happy if we don't cover it all today to come to the next session on the 22nd of March? We can go into it in a bit more detail, and I'll be there face to face to answer any questions. Is that okay?
That sounds good.
Yeah?
Excellent.
Brilliant. So I'll take a mark of where we end off.
Okay.
So with this in mind, managing and maintaining nutrition would not just look at whether a person can heat their food up or feed themselves. A good assessor should be looking at more than that. So let's maybe have a 2-minute discussion. Looking at these different images, what other things do you think a good assessor should be looking at? So just shout out your answers. So not just can the person feed themselves, using some of these images as prompt, what else do you think a good assessor should be asking?
Are they able to purchase food?
Yes, exactly.
Yeah.
Thank you.
Yeah, because it's self-sufficient as well. You know, you don't depend on people, because some
Can
people
they
still
get
like
fresh food?
independent.
Yeah, brilliant. Can they get fresh food? Thank you, Elsie, as well. Exactly.
And I
Are they
think payment.
food? So she goes.
Oh, okay.
Sorry.
Are they
So-
able to prepare the food?
Yes, exactly. Thank you. Did someone else want to jump in as well?
Culturally
I think you just
appropriate.
empower them really when you go in. I mean, when I used to go and do assessment quickly, I used to say, where is this nice smelling food? When I work in the sheltered housing, people came in with Meals and Weeds, and they want only 3 Meals and Weeds in that building.
Yeah. It's really terrible. But some really good points. And also, are they able to get to the shops? So I'll go on to some of these things. So a good assessor, a good assessment for managing and maintaining nutrition, would include, does the person know how to budget for food across the month and manage their money?
Yeah.
Does the person know what a good nutritious diet looks like, or take into account any allergy or dietary requirements? Does the person know how to plan a shopping list? Does the person know how to navigate the shops? Do they know how to find items and check for use by dates? Are they likely to stick at a list or end up buying items that they don't need? Does the person know how to store food and prepare it safely? Can they eat without support? So this is the level of scrutiny that an assessor should use for each of those 10 specific outcomes that we showed earlier. And this will determine whether or not the person's able to achieve that outcome. Yes, it's going to take time, but a meaningful assessment should. And it's worth either yourself or getting support to prepare for that beforehand. Yeah. So
Or do they go out and buy the cheap things if they see them in sale?
Mhm,
What do you do?
yes,
What do you
exactly.
do?
Yes. So you can see the level of detail that's needed, and with each of these specified outcomes. What does it mean now to not be able to achieve one of these outcomes. And this is the next step. So we've already looked at managing, maintaining nutrition. So if a person needs if a person needs assistance in any way, they're regarded as unable to achieve the outcome. And we see, especially for some communities where people are saying, oh, I can do it. But when I dig into it later, they're like, actually, I'm in
You
pain
can't do it.
afterwards.
You
Yeah,
can't do it.
exactly. And that's where you should be entitled to support. This implies to very minimal assistance because they require that assistance. For instance, prompting support. So you might have to remind somebody to eat, help them to open tins, to make their bed, run a bath, prepare for a shower. And this could be positive verbal encouragement to get people up in the morning. These are things that they're still entitled to look at as unable to achieve the outcome. So then they're entitled to support. They may be able to achieve the outcome without assistance, but in doing so, they're left anxious or in pain or in danger or causing a risk to themselves or others, or take significantly longer than is needed. If this is the case, they're regarded as unable to achieve the outcome. If you are unable to achieve 2 or more of those specified outcomes because of your, again, remember, physical, mental impairment or illness, then you meet step 2 of the National Eligibility Framework, and you should be entitled to social care. Oh, we've got onto step 3, which is great. And I'll probably stop at charging and do charging at the next session. So a quick recap of this National Eligibility Framework. So step 1 is that a person's needs must be based or caused by a physical, mental impairment or illness. Step 2 states that this physical, mental impairment or illness must prevent the person from achieving 2 or more of those specified outcomes in that list. If this is the case, the assessor needs to look at what impact not being able to meet these specified outcomes has on the person's well-being, if any. Now, this is step 3 of the National Eligibility Framework. The person meets step 3 if, as a consequence of not being able to meet these specified outcomes, there's likely to be a significant impact on their well-being. Now, just looking at the slides, this is very individual and subjective to the person with care and support needs. So it could be yourself or someone you're caring for. It's important for the assessor to remember that everyone is unique. They can't give blanket policies. So not getting out each week to the cinema, pub or restaurant or club might not impact me, but it might have a significant impact on yourself or the person you're caring for. Assessing impact on well-being covers areas such as personal dignity, so including being treated with respect, physical, mental health and emotional well-being, and protection from abuse and neglect. If somebody's well-being has been impacted by a lack of support in a particular area, it would be important to request an assessment. So lastly, we're nearly here. So these are typical quotes from some poor assessors during an assessment. So prompting support doesn't count. That's not accurate. We don't provide support with leisure activities. Recreational activities are non-essential. Again, that's inaccurate. The assessment won't cover managing finances. It's not an eligible need. And if you remember, it was on there. So it is. Yep, Elsie, you'll be surprised what they say. We won't cover cleaning. It's non-essential, even though you're in pain. Yep, that comes up. And we don't think that, this is an example, Molly's needs change in the winter, so we don't need to consider that. Again, these are all unlawful things. So I'm going to stop here. The next slide would have been charging. And just to mention before I stop that many local authorities, and we've seen it in Croydon, try to start the process with charging. That's unlawful and it puts people off so that they don't have to do an assessment. If that happens, please come through to the BME forum or myself and we can support you with that. Yeah. So what I'm going to do, I'm going to stop sharing. That was a lot and I'm actually losing my voice. Hi, everyone.
Can I ask, please, before you, I know this is a quick ask. Do you work with a Zuka in social care and health, in the social work side, the manager?
No.
I work side to side with her as a social worker. She's the head of
She's
the
still
adult
there?
social.
Brilliant.
She's the head of the adult social work in Croydon.
Elsie, I might have to message you and we'll talk separately because that's definitely needed. Thank you. connections can always
You
make us
need to
help make
work with those
change.
people, yes.
Yes. What we're trying to do is make sure we support people individually and have enough cases and examples before we go and challenge them or have conversations with them.
Another thing is, could I just say, please, sorry,
That's fine.
we did benefit, and I still asking, letting people know, they are entitled to taxi card, they are entitled to attendance allowance.
Yep,
I
yep.
know. If you look at the thing, independent, I have a book out there where they put my name at the front for the benefits.
Elsie, you're amazing. A part of what I want to do, and we'll do that in the next session, is look at other groups you think we should be talking to make sure as many people as
Yes.
possible know their rights.
Yeah.
Before I end the session, guys, I want to quickly, if that's okay, put a link in the room. There's only 4 questions just to help me kind of see if this is helpful, see how we can improve what we're doing. Is that all right if I throw that in there? It's literally only 4 questions, I believe.
That's fine. Yeah.
Yeah.
Yeah,
And
fine.
then we'll continue next on the 22nd, if I'm correct.
That's right. Yeah.
Excellent. So I'm going to put this in the chat. If I can ask everyone to click on that and just answer those 4 questions, and then when you're finished, we'll wrap up. Do you need any help with that? Can you see the link, everyone?
Yeah, but it's
Can I
gone.
just ask quickly, is this video going to be sent out to people? Because I missed half of it because I couldn't get
Yeah,
in.
I mean, I would love it to be, and yes, I have no problem with that.
Okay, that's lovely. Okay, thank you.
Yeah. We'll also just, I know that Tanya will probably send the video around and just remind everyone about the next session where I'll be face-to-face, and we'll have our chatbot tool that you can use and answer any questions. And if you do think you need a referral in, happy to do that on that day also. Yeah. We'll also send around the assessment pack with the presentation slides, so you've got it all. Yeah, and you can share that with as many people as possible.
It
That's great,
disappeared.
thank
The
you.
thing that we asked to do, it disappeared.
Disappeared. Let me put it back in.